My team has saved our average clients $1,856 per employee per year by improving benefits for those customers. And that's our average customer. Our lowest performing customers saved over $1,000 per employee per year. Our best performing customers save over $4,000 per employee per year.
Welcome. Today we have a change. As I may have mentioned before, we have evolved the podcast, Reframe for Resilience, to a new podcast, which is called the Antifragility Reframe podcast. And this actually will be our maiden podcast, if you like, on the new title, the Antifragility Reframe. Why Antifragility Reframe? As many of you know, Nassim Taleb wrote a book called Antifragility. And basically what he says in that book is that whereas resilience is bouncing back after a challenge, antifragility is bouncing forward, namely becoming stronger, getting better after a challenge. It's like training a muscle. With more training, that muscle becomes stronger. So this podcast is very similar to Reframe for Resilience, except I will be tasking the guests with really telling us and explaining to us how their reframe, their change in perspective, help either them personally or their clients to become stronger or better. Today's guest is Mr. Donovan Pyle. He is the CEO of Health Compass Consulting. He's the author of Fixing Healthcare, and he's a senior advisor of the Validation Institute. Mr. Pyle, welcome to our first episode of the Antifragility podcast.
Dr. Douglas, it is an honor to be here. Thanks for having me.
Well, this is exciting. And in our pre-interview discussion, you mentioned at least a couple of things, and I know you had more examples that really fit this topic. And I would love if you would tell the story as you introduce yourself about what you did initially and how that evolved to your present consulting. Tell that story of Mr. Rosen.
Sure. So I live in downtown Orlando, and there's a gentleman by the name of Harris Rosen who started Rosen Hotels in 1974 in Orlando. And in 1990, he got frustrated with the legacy health insurance and healthcare industry, and he basically decided to go his own way. And he started developing innovative ways to finance and procure healthcare for his employees in 1991. And over the next 30 years, he basically saved his company over $500 million on healthcare. But he did it by improving coverage and care for his now 6,000 employees. So much so that he built one of the best health plans in the country, and he saved, his organization so much money that he was able to do a tremendous amount of philanthropic work for disadvantaged populations throughout Central Florida. And it was a powerful legacy. Mr. Rosen unfortunately passed last year while I was writing my book. But I think it's important that we continue carrying the torch and the lessons learned from his pioneering work in this space.
What a wonderful example. So just capture that for us in two, three sentences. What was his challenge? What did he do? And how
His
did he benefit? And talking about his philanthropy, we talk about broad benefit in our reframe methodology. How did others beyond that benefit?
Yeah, great question. So the challenge was that his company's healthcare costs were spiraling out of control, far outpacing inflation, and he saw that that was really undermining not only the financial health of his organization, but in very real ways the physical health of his employees as well. People that can't afford a high deductible health plan, a $6,000 deductible, they tend to avoid the care that they often need. People that have diabetes are a great example of that. And so, he invested and took some risks to really go out his own way and find different ways to purchase healthcare for his employees. In that he started actually just partnering with physicians in downtown Orlando and inviting them to practice out of his empty space that he had in his hotel. And so that was the beginning of what became Rosen Care, and it's really become a model for employers who are serious about improving the financial and physical health of their organization.
Fantastic. So now tell us a little bit about how that impacted you as you continued in your own journey.
Sure. So, I was working for a large insurance company. Benefits brokers were my customers. So basically, just to level set for your audience, employers cover 164 million Americans with healthcare benefits each year. They spend $1.3 trillion on that. And the opportunity is that about 25% of what they're spending, roughly $4,000 per employee per year, is being wasted. So benefits brokers were my customers, and I would go to these open enrollment meetings, and quite frequently, the executives at the employer and the employees themselves would be frustrated because their health insurance costs just kept on going up. And often the only, opportunities to mitigate those increases, the only options they were presented with were to either absorb the increase, meaning erode profit margins, or pass rising expenses onto the employees in the way of, their employee contributions or copays and deductibles. And I saw that that was really just frustrating for so many stakeholders. And I was perplexed as to, here we are in Orlando in many cases, and why aren't these brokers um, at least, recommending some of these strategies and solutions that Harris Rosen had pioneered 30 years previously? And that was really um, alarming to me that they weren't shown these alternative ways to do this. And so I, very naively thought, geez, if I just move to the brokerage side of the industry, I can probably help a lot of people with these innovative strategies. I can probably build, grow my business within a brokerage firm, and I can probably make some money doing that. Um, to my surprise, that's not really what the objectives are of the legacy brokerage industry. And so I was actually terminated after building a book of business and helping our customers and advocating for our customers. And so that's really when the light bulb went off for me that, wow, we really need to develop a new revenue model to align ourselves with employers.
Very good. And do you want to tell us a little bit about that model that you now recommend and
Sure. So So at the end of the day, most businesses work with benefits brokers because they need help maximizing the return on their benefits investment. Benefits or healthcare specifically is often the second or third largest expense on corporate P&Ls. It's often the fastest growing financial risk on corporate P&Ls. And so, since most finance teams and HR teams don't have any technical training or much experience financing and procuring healthcare, they rely on outside experts. And so many of them rely on brokers. And and that's all good and fine, but the challenge is that the brokerage industry, and I detailed the history of this industry in my book. The brokerage industry was developed to serve as retail distribution for insurance companies. They were developed, the industry was developed to sell insurance products. And that's all good and fine, but that's a different value proposition from helping employers maximize the return on their investment. And and so, when I was terminated, I was told that I was being too hard on a specific insurer who happened to pay them their largest bonus each year. And they didn't like that. And so that made sense. Um, so after seeing how that misalignment and experiencing how that misalignment impacted employers and myself, I couldn't do the work that I wanted to do. I said, all right, let's reimagine the revenue model so that we can provide customers with unbiased advice on how to maximize the return on their investment. So what I did was I created a management consulting firm that actually serves has a fiduciary relationship with the employer. And and again, we did that so that we could provide them with unbiased advice on which strategies and solutions best were most appropriate for that organization to help them meet their objectives.
So, in a word, how has that improved the P&L, if you like,
Mm.
for your clients? And how does that get passed down to their employees? How do the employees benefit?
Yes, that's a great question. So going back to 2018, I'm very proud to say that, my team has saved our average clients $1,856 per employee per year by improving benefits for those customers. And that's our average customer. Our lowest performing customers saved over $1,000 per employee per year. Our best performing customers save over $4,000 per employee per year. And again, that's all by improving care and coverage for employees, not watering it down.
So, you improve care and
Mhm.
coverage at a lower cost. So, employees
Correct.
benefit and employers benefit. Great
Mhm.
example of anti-fragility, where in this case, both the employer and the employee have benefited and are in a better situation than they were before. Mr. Pyle, thank you very much. Your solution is not only timely, but very important. It is time for us to reframe. Actually, it's not a reframe because many have been talking about healthcare inequities and pointing to the social determinants as driving that, and that's going to become even clearer. So we really need to grasp those solutions that will give us better results than we have right now. Thank you very much for sharing that with us and helping us to launch the anti-fragility reframe.